All right, hey, let's go ahead and check your atlas. Lie on your back, 8 namefuls off the edge of table. A little further down, morning. That's good right there, never faked. All right. Okay, relax your legs for me. Nice and spaghetti legs. Awesome. Okay, and that looks perfect. Nice and even. Still, we'll be able to adjust the rest of your spine today. All right, so lay face down. See what we can find. All right, so go ahead and adjust your SI joints here. Now I use the table to do that, Patty, so the table comes up underneath your pelvis just like this and releases. So the SI joints here, what they do is those are the joints that move when you walk. So anytime those are compromised, that's where some low back pain or stiffness can come in, or just feeling fatigued when you have to walk or sit too much. There we go. Excellent. So what I'm looking for here is when you're laying face down, proprioceptively, or where your brain is it wants to know what's happening in the pelvis here. So always make sure the leg length is even in this position as well. And then bend your knees, point, okay? There we go. And that's nice and even as well. Let's do it well. Okay. This is called an activator. This is, again, a precision instrument in upper cervical practices. Sometimes they just simply stick to the atlas or then the axis, that cranial cervical junction, the very top portion of the brain. Here, but in all upper cervical practices, we don't do any twisting or turning of the neck. We don't turn the body or anything. Everything is done along the plane line of the spine. So we use specific instruments, sometimes our hands, again, sometimes the table, but there's no twisting or turning of the spine. And I love the activator because what I call it the clicker. Sounds more fun. So what I do is I find the segments that aren't moving properly. They stick. They feel sticky. Sometimes they even feel hot or spongy. Those are called subluxations that I'm looking for. Because again, subluxations are the only thing that chiropractors treat. And so what we're doing is we're looking for those joints that aren't moving properly. Sometimes, though, I love to use the activator to help release muscles, tendons, and ligaments as well, because they're all connected to the spine too. So I'm going to go ahead and look for all those areas like that, but that's doing really well there now. Let's see what's happening here. So all the major muscles of the back attach to the base of the skull right here. So I kind of bring my thumbs up here, make sure everything is nice and even in her case. Your head's on straight. However, how do you feel how tender that is right there?
It just feels tight.
Yeah. So that's a misalignment of the spine. So I use the activator here to put it back into proper alignment. I get around the area as well as in the muscle tissue. There we go. Just like that. See the difference in the tightness now? Yeah, so that lets go immediately. That specifically, well, you got all your neck muscles. You get musculoskeletal system. That's that area there. But also specifically thyroid's right there. Okay, you got your lymph tissue there, everything that goes around the neck there. So what I'm doing now is I'm just kind of feeling the movement of the spine in the mid-back right here. So it's right there. It's not moving well. It's a good stretch, but I also like to evaluate the rib heads because they're all attached there. You know, the lungs are in here. This right here, this curve right here, this is the first curve you have when you're born. You actually create these two curves as you start to lift up your head to start to walk. So this is that primary curve you're born with. There's so much musculature in here. This is where the largest muscles are in the back. And so what we're doing is we're just kind of making sure this area, you know, your heart, everything that's in the cavity of the rib cage is all in through here. So make sure that's functioning right. And I like to open up the spine as well, elongate the spine just to kind of open things up. This is everybody's favorite part. To everything open up here. But again, it's a very gentle adjustment. Again, there's no twisting or turning or anything like that. Okay, go ahead and sit on it. Again, that's what a lot of people are actually afraid of, is that twisting and that turning.
Yeah.
Okay. But, you know, when done by a qualified chiropractor, the twisting and turning, there's really no problem with that. However, we just like to remain as specific as possible in an upper cervical practice. I'm just working on our upper traps here. Right here, just to make sure they're nice and even. The nervous system controls everything. So when the hormones aren't functioning right, a lot of times, I tell my patients, let's look to the foundation first, because chiropractors don't treat hormones. We don't treat those hormonal deficiencies. What we do is we make sure the foundation, the system that controls everything, the nervous system, is functioning properly. From there, we can start looking nutritionally. We can start looking at detoxification, things like that. But unless that foundation is sound and set, you really are kind of, hitting your head up against a brick wall if that foundation isn't functioning properly. It's like we can't see in a dark room if we don't turn that light on. So, Betty, what have you noticed since starting care here that you have noticed that has changed as far as your health?
One thing that's big is because I just saw my doctor that does my bioidentical thyroid, and my thyroid has gone way down, so I'm taking less of the bioidentical, but also just that I'm very conscious of my posture.
Mm-hmm.
I think that's the biggest thing.
That's the reason why you came in, right?
That's why I came in.
Yeah.
So, because I was noticing when I put my hair up that I was protruding. And that was my main, and I so appreciate Dr. Taylor because I didn't realize my I needed to correct that so I wouldn't have surgery down the road.
Right. Right. Because, that's what's called, they actually call it Dowager's hump. Okay. And that's right here at the very bottom of the neck, at the very top of the mid back. And it's very prominent when, over time, we have a forward head posture. So it's because all those muscles back there, they get so tight, they're trying to keep your head up. Now, our brain wants our head up, eyes level with the horizon. Okay, because if our head starts going down and we start looking out the ground, well, we'll be lunch for that tiger around the corner, right? So we always want to make sure our head is up. And so with that hump back there, those muscles are very fatigued, very tired. And, for the most part, you weren't necessarily feeling pain.
No, I didn't have any pain.
Yeah.
Just thinking, I noticed that my mother had, and I thought, well, maybe this is hereditary. So, I was so glad I heard about you because I was just going to think, oh, well, this is normal. But, and I love that it's made me more conscientious about, getting my shoulders back. You don't want to feel bad in your later years.
Yeah. Also prevention for you, right? I know that's area down that she came in here for because, with that forward head posture, for every inch forward right here, we lose lung capacity. If our head's forward like this, you actually can lose up to 30% of your lung capacity. And that was actually a study done by an MD. So, think about it this way. How do you do this with me? We'll sit here together. I want you to bring your shoulders back and take a nice deep breath in. There we go. It feels pretty good, right? Mm-hmm. All right. So now what I want you to do is I want you to bring your hand forward like this. Now take a deep breath in. Can you breathe in as much? No. And we all know that. Yeah. But really, that is the simple truth, especially since we're more sedentary than we've ever been before in world history. We have this thing called text neck. We're always looking down at my phones. And it's an embryonal diagnosis code now, Hattie. Yeah. So, we put our head forward and we're looking like this. So we're perpetuating this problem. Yeah. Yeah, exactly. Mm-hmm. So, and that's what you were seeing as part of your posture. And you're actually seeing now, are you noticing change with that?
Definitely. I was in fact looked in the mirror this morning, put my hair up and went, I don't see it going out as much. So I know it takes time, but to continue feeling good because I feel very blessed. I don't have pain.
Yes.
So I'm excited. I came here. I think I do this pillow every night, and I think that helps me before I go to sleep. Yeah. Feel more relaxed. Yeah. And it's a very short time that you use it. Yeah. So I've seen a huge difference because I almost have to keep myself from falling asleep on. Yeah, because it relaxes, so it's a great thing to do before you go on to sleep.
Sleep position is really important, on your back or your side. That's supportive of your spine. When you're sleeping on your stomach, which a lot of people do, I used to be one of those people. You sleep on your stomach, think about it, your head has to be turned this way for 6 to 8 hours, however long you're sleeping in one direction. If you walked around all day with your head turned to one direction, do you think your neck would feel really great? Absolutely not. Now, this is the pillow that Patty uses. So what we have here is this is called a cervical pillow. It's my Pettibon. It's the brand that we use. And it's very, your neck actually goes over this right here. And it helps to restore not only the curve in your neck, but also to train those muscles to function properly. So Patty, you want to show people how you can sit yourself on?
It's very relaxing.
It's very relaxing, very easy. So here's your pillow there.
Maybe at this side.
Yes, that'll work better.
But you can, you can have your legs up or straight, but not crossed.
Right. It's not for sleeping. It is simply for 15 minutes a day. That's all it really takes. Think of this as the chiropractic really is like orthodontics for the spine. We're actually trying to correct the structure. If any structural correction is needed, we're trying to correct that. And this right here is the retainer. So you come in, you get adjusted, everything is moving correctly, everything's in a good place. But with this is going to really reinforce the muscles to sit properly and to bring the head back, especially at the end of the day with most people that are working at a computer all day. We're doing this all day. This is going to do the opposite of what we do all day to train those muscles to do what they're supposed to do, and it relaxes the whole spine all the way down. We even have one right here that we use for the low back as well. Some patients use this, some don't. Most do get the neck one, just primarily because that's what we've got going on. But if we've got patients that have loss of curve in their low back, we also prescribe this one for them to lie on 15 minutes a day as well.
And this has helped me too.
Yeah, absolutely. Thank you, Danny.